And welcome back. It is 9:30. October is Breast Cancer Awareness Month, and it's an opportunity to make sure that all women have the right information to take care of themselves.
Here to tell us more this morning live is Dr. Kate Lathrop. She's a breast medical oncologist with UT Health San Antonio, MD Anderson Cancer Center. Good morning, doctor.
Good morning.
Thanks for being with us here on GMSA at 9. Let's review, just to kind of recap, what are the primary risk factors for breast cancer?
Yeah, so breast cancer is the most common cancer that women have in the United States besides common skin cancers. So it's something that many of us either experience at some point during our life or know somebody very close to us who have had breast cancer. The risk factors, the biggest risk factor is age. So as women get older, their risk of developing breast cancer gets higher. There's also women who can have a genetic risk within their family. Although that's only about 10% of breast cancers, it's an important group for us to identify because there's prevention that we can implement to help decrease the risk of that woman ever developing a breast cancer. And then anything that increases our lifetime exposure to a hormone called estrogen, that will increase your risk of developing breast cancer. So that has to do with how early we start having our menstrual cycles, how late we go through menopause, how many children we have during our lifetimes, and whether we take supplemental estrogens to help with menopause symptoms. So those are all things that increase the risk of developing breast cancer.
And just a question many of us have, when and how often should a woman get her mammogram?
Yeah, it's a great question. And if you look at different recommendations from very thoughtful, well-meaning groups, they actually vary a little bit. So sometimes it's confusing because we might hear something that's slightly different than what we've heard in the past. But I think to simplify it, I think most people would agree that once you are around the age of 40, 45, start having a mammogram either once a year or every other year. And then continue having those mammograms until you reach an age where you either have a lot of significant medical problems or you have a shortened life expectancy for some reason. And I think this is a really important time for a woman to discuss this with their healthcare provider because there are some nuances. And I'd like to stress that this is a screening mammogram recommendation. This is not for women who have had an abnormal mammogram or have had breast cancer in the past. And it certainly doesn't apply to a woman who feels like she's had a change in her breast. Sometimes we've had patients say, well, I had a normal mammogram just a few months ago. So when I felt this lump in my breast, I thought, well, that can't be anything. I just had a mammogram. But that's really important that if you feel a change, if you notice something different, you need to let us know, because even having a normal mammogram within the year doesn't mean that there's not something new. And we don't want to have a delay in diagnosing a breast cancer because of a recent normal mammogram.
And speaking of those screenings, can you tell us about 2D versus 3D mammograms and which mammogram should a woman ask for?
Yeah, most mammograms these days are going to be more towards what we call 3D. So a long time ago, we used to have mammograms on films that we would put up on a light box. And then we moved to digital mammography, which is on a computer system. And most women nowadays are actually having what's called tomosynthesis mammograms. And that's what is being shown on most of your pictures here. Tomosynthesis is where we actually take multiple pictures of the breast in multiple dimensions. And it's almost more like the quality of a CT scan where a radiologist can look up and down and left and right through that breast. And it helps us find breast cancers at a much earlier stage when they're much easier to treat. So that most women today in our community are having tomosynthesis films.
Bullet point some ways to lower the risks of breast cancer, doctor.
Yeah, so there's lots of great ways to lower the risk, and one of them is just good for everything else too, which is diet and exercise. So obesity actually increases the risk of breast cancer. And so if you can maintain a healthy weight, you'll decrease your risk of breast cancer, but you also do all kinds of good stuff for your heart, your lungs, and decrease your risk of diabetes. The other thing that you can do is limit the amount of alcohol that you take. We know that alcohol, more than 1 drink a day for women, does increase their risk of developing breast cancer. And then if you have other family history or genetic concerns, definitely talk to your primary care doctor about that to see if you need to be screened for certain genetic heritable mutations that can also put you at risk.
All right, Dr. Kate Lathrop with UT Health San Antonio, MD Anderson Cancer Center. Thank you so much for joining us this morning.
Thank you, and thanks for getting the word out.
Thanks.